A little bit of my background: I'm a naturopathic doctor here in Red Deer. I own a naturopathic clinic, but I did all my training in the U.S. So we're actually trained as primary care providers in the U.S. as a family doctor is here in Alberta. So we get to kind of live in both worlds of naturopathic medicine and what I call conventional medicine. So in the U.S., practice with full prescription rights and hospital imaging and lab imaging and all of that at my fingertips, but having the education of the specialty of naturopathic medicine, which includes things like lifestyle and nutrition changes, high-dose vitamins, herbal medicines, different things like that. So my approach is what I call really integrative. I kind of sit in the middle for patients when they come in with different conditions or different goals for their health, and we can pick and choose what's going to work best from them from both the conventional world, as there is a time and a place for prescription medications and other treatments, and then we bring in the naturopathic piece as much as we can in those situations as well. So kind of understanding of both medical worlds and meeting people where they're at, what they're looking for from a naturopathic standpoint. In our practice, we see little ones from newborns a few days old all the way up to the geriatric population as well. But most of my specialties in gastrointestinal issues, so IBS, Crohn's, heartburn, ulcers, different types of reflux disease, things like that, and then a lot of hormones as well. And that's going to be my hopes of talking with you guys on both foods a little bit tonight and hormones a bit tonight. 2 hours is a long period of time, but also really short when all the great things that we have to chat about. So my goal tonight is to talk about foods first, food intolerances, food sensitivities, probably for about 40-ish minutes, leave 10 or 15 minutes to answer questions, maybe take a little breather, a stretch, that sort of thing, and then we can move on to hormone topic as well tonight. Again, I probably won't be able to get through all hormones, but at least hit some really big points in another 45 minutes or so to leave lots of time for questions. For me, I want this to be definitely interactive in the last 15 minutes or so of each time, so that everybody feels like they have an understanding of what I'm chatting about and also getting questions answered that they're looking to get answered. All right. Out of curiosity, anybody has been to a naturopathic doctor before? Perfect. I see one little hand in there, not to give it away too much. So, but I mean, awesome. So a good group of you guys who have not been. So this is going to be a lot of new information tonight, which is exciting, and hopefully answer some questions for you guys and get things going that way. So as we're trying to load the PowerPoints, I'm just going to start chatting away. I'm just going to bring my computer over here a little bit just as a starting off point for me, and we'll go from there. So has anybody heard of food intolerances, food sensitivities? So we hear more and more people who can't eat wheat or dairy, or they don't feel well when they eat these foods. So it's a big topic that's out there these days, and we're seeing more and more awareness about it, which also brings up the discussion about fad as well. I have a lot of patients in my office and say, is this whole gluten thing a fad, or do people really not sit well when they eat these foods? And it's a bit of both. I mean, obviously, the food world is doing well off intolerances and the promotion of intolerances. So the big thing for me is it's really important to actually get a diagnosis and know, are these foods truly an issue for you? And if so, what sort of symptoms are coming up when we eat these foods? So everything from asthma, eczema, psoriasis, struggles losing weight, bowel concerns, all of those can come up from having food intolerances and food sensitivities. And the main thing is that we're not talking about true food allergies. So we think of a child with a peanut allergy who's, anaphylactic, hives, throat closes, life-threatening, etc. By this stage of your life whether you have an allergy or not. Most patients do not. So when we're talking about struggles losing weight or fatigue, we're talking about intolerances and sensitivities, which is a delayed reaction to foods. So food intolerances can take up to 96 hours for your body to react. That's what makes them so difficult to diagnose, or for you as a patient to realize the connection between the food you're eating and what's happening 2 to 3 days later. So something that you had for breakfast today, something that you had for dinner 2 days ago, might be the culprit on why your bowels are struggling or why you've retained 5 pounds of water since the night before. So you'll hear patients say that, I went and ate out. I don't eat out very often, but I did, and the scale moved 5 to 10 pounds from when I went to bed to when I woke up. Obviously, we can't gain or lose muscle or fat that quickly. That's all water retention and a very common symptom of food intolerances or food sensitivities. Okay, so with food intolerances, again, just think chronic inflammation. These are conditions that wax and wane. They never go away for an 8-week stretch all by themselves. Some weeks are better than other weeks, whether we're talking about your bowels or talking about water retention or talking about eczema, but there's definitely this waxing and waning that's taking place. All right, so for food intolerances, how do we identify what problem foods are for people? Who's heard of an elimination challenge diet? See one hand. Elimination challenge diets are basically where for 4 to 6 weeks, we wipe out all the good stuff down to maybe 6 or 7 hypoallergenic foods, and that's all you eat for 4 to 6 weeks. Once the symptoms clear, then you add one food back in at a time about every 3 days to see if you react to it or not. Really tough process to go through, not enjoyable, tough to do in busy lifestyles in these days of 2015. And even when patients go through that process, there's still a lot of uncertainty about what foods really do or do not bug them. Sometimes they put a food in and they have an immediate reaction, so it's really obvious. But other times patients look at me and say, oh, I'm not sure, I challenged those in, I still don't feel great, I don't know if it's a problem or not. So it's very frustrating when you go through that process and all that work and it's still some uncertainty about which foods are good or not for you. So in our office we go to blood testing. So it's a blood test that goes to a lab down in Calgary, and that lab looks at 96 different foods. So it goes through dairy category, nuts and grains, wheats, gluten, soys, including some of the legumes category in there, meats including eggs, fruits and veggies, sugar canes, yeasts. So the majority of what we're all eating on a day-to-day basis can all get captured on a blood test. And for each and every food on that blood test, it shows your degree of reactivity that's showing up. So A, do you have an intolerance to a food? And B, to what severity? Sometimes we see patients with little minor intolerances that I say, there's no way this is what's going to be causing your health concerns. Other food groups obviously are a 6 out of 6 and are a significant factor in that person's health. So it really lets us assess what are the right foods for you before we go start eliminating a bunch of groups sort of blindly at that situation, especially in kids. You know, we want to leave as many food groups as possible in the child's diet. So I prefer to test first so we can leave as many options as they can have at that point. Okay. Food testing, and if this gets pulled up, I'll be able to show you some sample reports of patients. So everybody kind of picks on dairy and gluten very often. There's a lot of patients who do just fine with dairy. I had a lady this morning in for results, and it was just eggs for her. Everything else looked really good, and that was something she ate a lot of. It's obviously a good food, a good protein source, something she could easily take to work in her daily routine, and that was the culprit. She had tried a wheat-free diet in the past with other practitioners, didn't feel any different. She had tried dairy-free, she had tried going soy-free, so she did a lot of that work but just didn't feel any different for her intestinal concerns. And when we saw her results today, there's no surprise why that didn't make a difference, as those foods were good for her anyways. Sometimes as well, people will try an elimination diet at home and say, hey, I took out dairy and it did nothing. So then I took out gluten and it did nothing. Oftentimes people have more than one food intolerance at once. So for example, if you struggle with dairy and gluten, but you only took out the dairy, the gluten in their diet is still going to be leading to the symptoms that you're struggling with. So again, it's best to sort of identify what foods are problem foods, take all of them out at once, and then move forward from there. Does that make sense? Any questions about the differences between a true allergy versus an intolerance? Okay, so again, lots of these people that say, you know, I don't eat wheat or I don't eat dairy, a lot of times they're speaking to their intolerance, not that they're having a life-threatening reaction to those foods.
I still haven't received the email.
Really?
Some of us.
Let's just see. Outbox. Yeah, it's still coming your way. It's being sent. Okay. All right, some cool stats I just want to throw out there and how important the gut is. And my understanding is that everybody is working on sort of weight loss, weight optimization. Is that my understanding right, Colleen? So all of a sudden people oftentimes say, how's the food intolerance fit with me trying to lose weight? And what I describe is that 90% of people eat really good, they work hard, whatever sort of physical activity that is that they're interested in, and they tend to manage their weight or lose weight successfully or find it fairly easy. And I have patients say, yeah, when I put in the work, my weight changes. That's 90% of people, but I find there's that 10% that say, I'm doing all the right things. I'm eating super clean, I'm paying attention to my caloric intake, I'm working out, different variety from yoga, Pilates, strength training, whatever that is, yet nothing seems to move. That 10% is where I say there's a roadblock. Something is not allowing that person's body to respond as they'd expect. This is a great place where food intolerances come into this discussion because it's a common roadblock that we see show up. When you sprain your ankle swells. That's the immune response to have that happen. The same thing happens in your bowel. If you're eating a lot of foods that are causing inflammation, you're starting to retain water because of your immune response. That happens from head to toe, and that comes into that water retention standpoint. So you'll have water weight that you're constantly battling to see that number change on the scale. The other interesting thing is there's a really neat hormone that there's more and more information coming out about called ghrelin. Has anybody heard of ghrelin or read about it? Sort of a hot topic in weight loss medicine. It actually is one of the drivers of our appetite. So as ghrelin levels increase, our appetites increase. What we have found is patients who eat their food intolerances on a consistent basis always have a higher level of the ghrelin hormone when tested than someone who's removed that inflammatory response. So we find patients who eat their food intolerances are constantly having an increased appetite and are not feeling satisfied, which obviously affects their ability to improve their nutrition. So appetite is affected, and then the water retention piece that fits into that as well is what can make it really difficult with food intolerances. And again, that's one of the first roadblocks we look at for someone's weight who's not responding when they feel like they're doing all the right things. Hormones is the second roadblock, which we'll get in a little bit later today. All right. The other thing which is interesting is as patients remove their intolerances, they always say, they come in and say, I feel more satisfied. I'm eating better. I've cut this stuff out. I don't find like I'm needing food every 2 hours. And again, that's that ghrelin hormone that's now normalizing, and they find that eating a good, healthy breakfast can actually stick with them a lot longer than what was happening prior to getting those intolerances out. People often ask as well, how can the gut be important for weight? Some really cool stats. So in our intestinal tract, there's 100 billion viable cells in our gut. We hear all these new things about probiotics. We hear about this leaky gut. Who's heard the term leaky gut? Awesome. So I'm going to touch on that in just a few minutes as well. So 100 billion microbes in the human body, 10 to the third billion cells in the human body. And if we think about a billion viable microbes on the skin, so we talk about our skin has so many microbes, not even close compared to our gut. So it is so important on gut health for everything else in the rest of a sort of called downstream. As a naturopath, it's all about gut first because nutrition is what fuels us. Nutrition is what gives us vitamins, minerals, etc. to get our other organ systems to work well. Whether we're talking about our neurological system or our hormone system, if the gut isn't working well, there's going to be some strain on those other organs because we're not getting our fuel source on a consistent basis, or we're not absorbing vitamins, minerals, etc. The microflora, all the bacteria in our gut, weighs 1.5 kilograms. So again, we start thinking about the importance of that bowel. About half of our fecal mass is bacterial biomass of normal, healthy bacteria that's in our intestinal tract that sheds. So a couple things I didn't chat about when we talk about chronic symptoms of somebody with food intolerances. I mentioned a few. Headaches would fall in there, fatigue, chronic sinus congestion, so that post-nasal drip every single day, all year round. Oftentimes is food intolerances in adults. When somebody, obviously from April to July 1st, struggles with seasonal allergies, then their symptoms are gone, clearly that can only be an environmental factor. But if someone's allergy symptoms are persisting all year round where we live, when nothing's living outside on a day like today, it boils down to two potentials, something in their diet or something in their home. And a lot of time the diet's a major component to that. So we talked a little bit about the fluid retention. Everybody asks, I hear so much about people having intolerances. Really, how many people truly have an intolerance to food? And what the research has shown us is about 1 in 3 people. If we took 100 people off the street, 30% of them, 33% would have a food intolerance or food sensitivity. Doesn't sound like a lot, but if we look in medicine, any other condition that happens in 1 in 3 people, that's pretty much an epidemic. You look at diabetes rates, things like that. So if 1 in 3 truly have an intolerance or sensitivity, that's why we're hearing so much about foods, both in the media, both in the grocery store when we're shopping, etc. Give you an update there. Still coming slowly but surely. All right, so let's chat about leaky gut. I saw some head shakes, and this is a popular topic that fits in, like I said, to weight, eczema, etc. Leaky gut is really understanding the whole point of how our digestive tract can affect the rest of our health. Obviously, our gut can't leak. If it did, you'd be in the ER fighting for your life on IV antibiotics. So it's sort of a loose term I'm not a huge fan of, but it makes a little bit of sense in that a healthy gut, if it's working well, has what we call tight junctions in it. So very little things pass between inside your bowel and into the bloodstream. Things that pass are vitamins, minerals, nutrients, proteins from our food, all of those things that are supposed to get through these tiny little spots. When they do, our bloodstream picks it up and delivers it to the rest of our body and provides our nutrition. When someone has food intolerances or somebody's had lots of antibiotics, that's disrupted their healthy bacteria in their gut, and we result in inflammation, like everything else, that inflammation opens these little tight junctions up in our bowel. Still microscopic, not real holes that are visible, but enough that now things are starting to pass through that bowel that shouldn't be. So we talk about food additives, food colors, food dyes. We talk about pesticides that are on foods. I have patients that can eat an organic apple and have no issue. They eat a conventional apple, they are sick with like a histamine response, hives, rashes, bowel issues. That's somebody's gut who is allowing those pesticides and chemicals to pass into their bloodstream. When those things pass into the bloodstream, our immune system says, hey, this isn't supposed to be here, and that creates an inflammatory response. So that's all really leaky gut is, are things that are passing through into the bloodstream that shouldn't be passing, which means our immune system responds. Whether that shows up as eczema, whether that shows up as difficulties losing weight, or asthma or psoriasis, that varies from person to person, and oftentimes by age as well in terms of what the most prominent are. In children, for example, ear infections, chronic ear infections, eczema is very common. Or adults, as I said, fatigue, weight issues, chronic sinusitis, those are common symptoms that show up with food intolerances and food sensitivities. How do we get food intolerances? There's always a genetic piece, of course. So a lot of patients I'll find, especially in moms who nurse and have young kids with concerns, we'll see a lot of similarities between food intolerances. So there's clearly a genetic component that went through that. The big discussion that we have is the dose of how much we're getting of these foods. Has anybody tried a food elimination before of a specific group, like gluten or dairy or things like that? Or sugar, I know that's a common one. And once you try to eliminate one of those foods, you realize it's in everything, right? Whenever we become really hyper aware of it. So you start realizing that, geez, I don't eat a bad diet, but I had no idea that the grams of sugar that showed up in soups or salad dressings or these things that were quote unquote healthy foods really builds up over the course of a regular day, not counting the pop or the Slurpee or the chocolate bar. I mean, that just takes it to a new level. Just eating healthy, you can get a lot of sugar in your diet without even realizing it. So what we've found is just we get so much exposure to wheats, to dairy, to eggs. It's in the majority of our foods in North America. So for a lot of people, they just can't handle the dose of it on what they're getting on a day-to-day basis. First age of contact is a big discussion of food introduction with kids can determine your likelihood of getting food intolerances, food sensitivity, and that famous word stress always comes into play as well. Stress and the bowels go so close together. If we look at irritable bowel syndrome, stress plays a big role in people's symptoms or their IBS flare-ups. Stress is a huge component to that. So again, when we think about stress and we think about outlets that our body uses to rid stress, the stomach and the intestinal tract is a really big part of that. If anybody's had to speak in front of a group or get in a situation at work and you kind of got that nervous energy in the stomach, that's your stress response. So someone who's in a chronic stress situation oftentimes also struggles with food intolerances and food sensitivities. My main concern, and again, this fits back to the weight component with people with leaky gut or chronic food intolerances that they're still eating, is mineral and nutrient deficiencies. Again, so as we're trying to lose weight, things like B12 is really important for our bodies to metabolize and lose weight. B12 is one of the most common nutrient deficiencies with people with chronic food intolerances and food sensitivities. So when we're getting annual labs run at an annual exam with your family doctor, we're looking for optimal levels of B12 and vitamin D and iron and all these things. And if they're low, we start questioning, are we not getting this in your food, or are you getting it in your food and you're just not absorbing it? And if it's the absorption issue, then obviously something needs to be done to address that at that point in time. Let's chat a little bit. The extreme version, I guess, of someone who's had long-standing food intolerances not being addressed are as multiple chemical sensitivities. So you start responding to the smell of perfumes or gasoline or paint exposure. So someone moves into a new home, lots of off-gassing in new homes of paints and cabinets and flooring. So some patients become really sensitive to their environment. Again, it goes back to their intestinal tract and their immune system being inflamed as well. So again, if I don't get this pulled up in terms of patient results, I'm going to send you guys slides of all of that as well to make sure you guys have a copy so you can see what it looks like to have a food intolerance test run. Just going to try to resend this. It seems to be going super slow. Or if I can send one at a time. The other big question I get, has anybody heard of food testing before, blood testing for food intolerances? See a few head shakes. So one of the most common questions I get is it really a good test? Is it even accurate? Patients say, I heard bad things. I heard it doesn't really tell us, very well if that is a food problem or not. And what I'll say is that food testing is a very good test. In the testing world of medicine, no test is 100%, unfortunately. We look at how sensitive or how specific those tests are. So if you really have a food intolerance, what's the chance that the test catches it? And if my test says it's positive, what's the chance you really have it? Both of those are in the high 80s for this type of testing, which is a really good test. So I've been using this company specifically going on 9 years. And for me, what I'll say is if it's not exact for patients, it is darn close that gets us the clinical results that we're looking for. So there's been lots of studies saying if we look at somebody's positives on this blood test and we do an elimination diet based on that, what's the success rate with things like weight loss and IBS? And the research is very, very strong. So I always tell patients a very good test, but you need to be eating foods that we're testing for. So if someone is suspecting gluten as a culprit and they've had it out for the last 12 months, not going to be a helpful thing to run the test at that point in time because your immune system has not seen it for so long, it'll show up as a false negative. So what I tell patients is that if you're truly questioning any foods in your diet, causing health concerns, preventing weight from being where you want it to be, you need to be eating those foods for a consistent basis for 4 to 6 weeks before you get tested. Okay? So always keep that in mind that if anyone's doing testing, make sure you're eating the food. So number one, as I want you guys to know that there is a way to identify if you're sensitive to foods, that being the food test. I want you to know some of those common symptoms that show up, as we said, weight management, eczema, psoriasis, sinus issues, etc. The big question is, you get a blood test, it's positive for dairy, for example, what do? What's the process going forward? First off, intolerances are not meant to be a forever removal, like a true allergy. Our goal is to eliminate those foods, heal up your digestive tract, and then challenge those foods back into your diet at that point in time. So number one is we got to get the culprit out. I compare it to burning your hand on the stove. Step one is take your hand off the element so it quits burning. That's your food sources that we're going to be cutting out. Then we're going to be putting things to basically heal up that tissue. Yes, a burn on the hand will eventually heal. It may have more scar tissue than normal, but we usually are going to apply something topically to speed that process up or to make sure we heal it to the best ability that we can. That's where the naturopathic piece comes in. So I'm going to talk about a few common treatments that we use. The other aspect is how long do we keep these foods out? And that really depends on the severity of your reaction. If somebody's a 6 out of 6 reaction to dairy, they're off the charts. We're looking at least 12 months of food removal of that food group before we'd even consider challenging it back into their diet. So a couple things, severity of the reaction and how somebody's doing. Younger people, children, pediatrics tend to respond really quickly. So what might take an adult 12 months of removal before challenging in, some kids we challenge foods within 3 months and they do just fine. So those are going to be those individual factors that play a role. In terms of healing, who's ever taken a probiotic in here? I said it just for the heck of it or don't need no reason, but okay, 25% of people. So probiotics are really important. It's not that you're necessarily going to feel better when you take a probiotic with your bowels. You can take all the probiotic in the world, but if you're eating a food intolerance every single day, it's not going to overpower that food choice. It still all starts with diet, food first every time. The supplements are just to help out on the healing side. So probiotics are helpful if we've removed a food intolerance to start putting all the good bacteria back into your stomach again. That's going to be more preventative down the road of your immune system reacting to food groups. So it's going to kind of strengthen your digestive tract and give us a better chance of challenging those foods in with success once we do that down the road. Okay? Fire away.
So are you talking probiotics in yogurt, or are you talking with
Great,
culture?
great point. Yeah, great point. So
how much?
absolutely. So probiotics, let's delve a little bit down that road. Because I have a lot of patients say, I'm eating yogurt, isn't that good? For maintenance, eating yogurts and kefirs and some of these naturally fermented foods is a great way to keep your bowel healthy. But that's someone who has no intestinal issues, no food intolerances, and is looking just to optimize their health. For somebody who has confirmed intolerances, we need a lot more probiotic than what's in a yogurt, for example. And a lot of patients maybe have a dairy intolerance as well. So yogurt is not going to be a reasonable option for them to get their probiotics that way. So we go to probiotics, and I'll say dosing can range anywhere from 20 billion units a day up to 100 billion units a day, depending again on severity, depending if there's antibiotics involved. So a good maintenance dose for people is about 20 billion units a day. What you'll find is most over-the-counter products, unless you're going to a good health food store, is going to be quite a ways below that. Your better health food stores in town, Nutters, Golden Sun, things like that, they're going to have good quality, high potency probiotics that are going to be getting into those numbers. You don't need to be on them forever. Let's say over the period of 6 months, we repair your bowel, your foods have been out, all your intestinal symptoms have improved, weight's improved, or whatever that marker is we're looking for. Now we can go back to maintenance with yogurt-based probiotics or kefir-based probiotics. Those are great options once somebody's bowel has been fixed to where it needed to be from a symptom standpoint. Okay? The other issue with probiotics is quality matters. You get what you pay for when it comes to probiotics. There's a great study in the US where they went to health food stores. They pulled over 50 probiotics off the shelf. All they did is they went to confirm that A, the bacteria that it said was in it was really in it, and B, they looked to see if it was living or viable. Under 10 of the products actually had living bacteria in it still at that point in time. So the majority of over-the-counter probiotics, especially the lower quality stuff, pharmacy brand, etc., doesn't have what it has in it if it's even living at all at that point. So if you've tried probiotics that were of lower quality and didn't see success, that might be that you just really weren't getting any therapy from it at all at that point. So again, you really get what you pay for when it comes to probiotics. A good quality health food store makes a really big difference. I always tell patients, if you're paying to be taking these pills, let's make sure you're getting some benefit from it. It's not always about that cost per pill over the month. Okay?
So then normally they have to be chilled, is that correct?
Yeah.
And then my experience is they cause some bloating as well.
So another great question, we'll delve on that. So number one, most good probiotics do need to be refrigerated. That's a general rule of thumb. Doesn't apply across the board, but tends to be a good rule of thumb. If it needs to be refrigerated, it's a better option for you to be taking. Bloating can come from a few things. Again, probably I see that in about 10 to 15% of patients with probiotics. So some probiotics out there come with sort of a prebiotic, a food in it for that probiotic to grow better once it gets in the intestinal tract. That prebiotic is a type of sugar. So for a lot of patients, that type of sugar creates more gas and bloating. Their symptoms worsen. So if you ever take a probiotic and you're more bloated, more gassy, very likely you're responding to the prebiotic in there. The prebiotics will say like FOS or GOS. It'll have a saccharide or a sugar-based name to it. That's what's probably causing you the issue, not the actual probiotic itself. So there are probiotics that don't have those prebiotics or that food in it, and most likely, or most of the time, when patients switch to one of those, they don't have any of that gas or bloating. So if you ever take a probiotic and it seems worse, just try that quick switch, and that alone will probably make the difference for you. Okay?
Thank you.
Yeah, absolutely. Any other questions about probiotics as we're on the topic?
Can you take too much?
Yeah.
Anytime?
Yeah, I mean, technically there is too much. I see it show up mostly as loose stools or diarrhea for patients. So if you've started a probiotic and you seem to be tolerating it well and you've upped the dosage and any loose stools or diarrhea shows up, you're probably overshooting what your body can handle at that point. But other than that, that's about the worst side effect that's going to show up from it. Okay? Yep.
Sorry.
No, it's all good.
Kombucha.
Kombucha, yeah.
That has a probiotic.
It does.
As well.
Absolutely.
You recommend it, and I've read some side effects and stuff.
Yeah, I think kombucha, again, is another great naturally fermented source of probiotics. So again, if someone's looking to optimal health, maintain a good bowel, not necessarily any bowel concerns, kombucha is fantastic. For other patients who may have yeast overgrowth or other issues with their healthy versus their bad bacteria in their gut, things like kombucha and kefir can actually worsen their symptoms. So again, if you drink kombucha or you try kefir and it makes your bowels way worse, a red flag to seek out some help that you're probably in a small percentage of people that something else is going on. All right. Other questions? Okay, awesome. And I say, and fire away, because like I say, hopefully it's the worst thing. I'll take the break and see if we can do something different with the slides as well. So probiotics is a big one. Has anybody heard of L-glutamine? More comes from the workout world initially. Yeah, muscle recovery, that sort of thing. So L-glutamine is a great fuel for the muscles, no question. But L-glutamine is also one of the #1 fuel sources for the cells that line our gut. So for someone who's had chronic bowel issues, lots of inflammation in their bowel, and we cut the foods out, L-glutamine is an awesome amino acid to really speed up the healing of the bowel tract at that point. Like I say, it's a fuel for the cells that line our bowel. So if you're working out, kind of a double bonus, a little bit of muscle recovery from it, a little bit of bowel as well. When we think muscle recovery, it's usually really big doses of L-glutamine. For the bowels, anything from like 1 to 3 grams does the trick. Or in the workout world, I know we're getting way above 3 lots of times for muscle recovery. So again, these are things we do for patients who have already ridded their food intolerances. Again, trying to strengthen their intestinal tract. Enzymes, digestive enzymes, that's a really common one people try. Sometimes it helps, sometimes it doesn't. Again, you can take a digestive enzyme all you want. If you're eating lots of food intolerances, you're going to be limited on the success that you see with them. And somebody should not be dependent on digestive enzymes every single meal for the rest of their life. So if you know someone or you are someone who your bowel does not function without digestive enzymes, we know we're just covering up a symptom. You shouldn't be reliant on them. Something is going on. So again, for enzymes, I think we'll use them daily for the first couple of months, but after that, it's as needed. Someone goes out for dinner, eats a richer meal than they normally would. That's where an enzyme can be helpful to digest, but you shouldn't have to be reliant on it for all of your meals every single day. Okay? Quercetin and fish oil. Fish oils are awesome for lots of different reasons. Fish oils are a really great anti-inflammatory. So again, if we have inflammation in the bowel, fish oil is one of the best supplements to help stop that inflammation. Okay? So again, a lot of patients that come to my office, they're on probiotics, they're on digestive enzymes, they're on fish oils, they're on all these great things that they're spending a lot of money on from the health food store, but all their symptoms are there. Again, that's when you know we're missing the underlying cause. One of the biggest things in naturopathic medicine is we want to get to the root cause of the issue. I don't want you to be on a bunch of pills, natural or prescription, to be covering up symptoms. Something's still going on if you're taking all those things and your digestive health isn't right. Digestive health isn't right, it's going to be a roadblock to weight, almost guaranteed. You'll hear people, there's a lot of fad diets out there, they'll try the paleo diet, right? Someone says, oh, I tried paleo, I lost a bunch of weight, I felt great, my body just looks a lot better. Somewhere in that paleo diet, that person probably removed the food intolerance without realizing it. And that's why they're responding so well. Because the next person tries a paleo diet and says, didn't make a difference, or I felt worse, or whatever that is. So there's no perfect diet. I hate the word diet to begin with. It tells me it's a short-term fix, which is obviously not what we're going for. We're going for a long-term change. So I like that lifestyle change better. But whatever nutritional piece it is, not one diet fits all. And we see it over and over again. Every new book, or there's a paleo diet, or there's grain-free, and that works for some people, but doesn't work for everybody. So our whole goal of food intolerance testing is trying to individualize that to each single person. You know, dairy may be great for you, but not the next person. So we want to know, let's leave you all your food options you can, but let's cut out the stuff that is not allowing you to feel better at that point in time. Does that make sense? So like I say, it doesn't hurt to try a paleo diet as an example. There are diets out there that aren't a good thing, but something like a paleo doesn't hurt to try, but you may not get the results as a family member, a friend, etc. All right? So as I spoke before about the nutrient absorption, so it's hard to work out, exercise when you're fatigued. So if you've had food intolerances, you're low on B12, you're low on iron, we're low on vitamin D. We need to now replenish these nutrients. So we need to build them back up so that energy levels are great, your workouts are great. I have a lot of patients who say all of a sudden, 10 minutes into a workout, they just hit a wall. There's a couple reasons for that, but under optimal nutrition or minerals could be part of that. So once everybody's healed up their bowel, now it's loading up with a good multivitamin. Maybe we're doing B12 injections or a B12 supplement from the health food store. The goal now is to see where are we deficient, and let's fix those deficiencies. That will improve weight loss and metabolism. Again, we look at the importance of B vitamins and metabolism. If those are low because you haven't been absorbing it from your food, we need to get that upped at that point in time to get somebody improving weight, metabolism, energy, etc. So that's sort of the three-step process. Number one, are you eating a food that's not good for you? Number two, let's cut it out and heal your bowel. Number three, let's replenish all the good things that you should have had prior and make sure that your body's getting everything it needs at that point. Does that sort of three-step process make sense? And again, these are people who are doing all the right stuff and you're just not seeing change. You're sort of falling in that 10% window of why am I not getting better? Why am I not losing weight? Why is my bowel still being unpredictable the way that they are? Okay? Actually, I didn't miss anything off the top of my head here. We talked about probiotics, which is excellent. Actually, one more thing I want to make on the probiotics discussion. One of the most common patients I get in my office from patients is, do I take probiotics with food or without food? I hear that often. All the research shows that probiotics should be with food. The main reason being is that anything else, including bacteria, that it's all susceptible to the hydrochloric acid in our stomach. Our stomach is a very acidic environment for a reason, to kill off bugs that are in our foods, to prevent intestinal infections. So if we're taking probiotic on an empty stomach, we're killing off a lot of those probiotics, especially the lower qualities. Your higher quality, higher end probiotics, they do research to show that it can stand up to hydrochloric acid in case it's not taken with enough food, but it's still advised to take it with food to get the best effect from those. I always go back and think about, how did this all come up anyways? Before they made probiotic capsules, how did we get our probiotics? We got it from food. So if we go back, it makes sense. Probiotics should be digested with food at the same time, because historically, that's the only source that we got it from at that point in time as well. So keep that in mind. I know there's some enteric-coated probiotics out there that they claim to take without food. Enteric-coated is where they put it in a fancy capsule to get past the stomach. There's not a lot of great research showing us that enteric encapsulated probiotic do a good job of actually seeding the gut. So again, take your probiotics with food. It's going to be the best way to go about it. And Yeah, so I say a big thing for me, out of all the health conditions, if you think food is preventing you from reaching health goals, the simple first thing to do is just get tested. Answers the question yes or no if that's a piece to the puzzle or not. Okay? Yeah, fine.
So when you talk about a blood test,
Yes.
What test specifically are you speaking of?
Yeah, so we're talking about a food intolerance blood test. I've got a bunch of handouts I'm going to give all of you guys today when you leave that summarizes some of these tests I'm talking about today, so you have more information about it, okay? It touches on a couple tests I won't get to, but the food tests will be on there, some of the hormone tests we talk about will be on there, but we're talking about a food intolerance blood test. So what's happening is we're taking a blood sample, sending it to the lab, and the lab is actually looking at how strongly your immune system responds to all the different antigens in 96 different foods.
And it has a name to it. I know my doctor did one for me,
Okay?
but it wasn't the skin test, but it was...
Yes, it's not a skin prick test.
Yeah, it was a different one where they took blood for it.
That's right.
Yeah.
So the biggest difference being that is in the conventional medical world, they don't do food intolerance and food sensitivity testing. And this is the other big discussion we always get into back and forth. So conventionally, they'll do blood testing for true food allergies.
Right.
It will go through eggs and shellfish and peanuts and all those things, but it's looking for a true food allergy, which is why most often when patients think they have a food issue and they get that blood test, it's negative. Most patients come and say, yeah, I have no food allergies, which is true. I wouldn't expect a food allergy to be present for a lot of these chronic conditions we're talking about. So the food intolerance, food sensitivity test is looking at a totally different part of the immune system. And like I say, right now in the conventional world, it's not done because Alberta Health or no other provincial health program will cover that test. Okay.
So what about the skin test then?
Great question. So skin prick testing obviously goes back to having that immediate reaction. So we're looking for true allergies. Again, whether we're skin prick testing grasses, molds, etc., or we're skin prick testing cow's milk and peanut and things like that, we're looking for a true allergy response, which again would not be interfering with some of these conditions that we spoke about. So the skin prick test and the blood test are actually looking both at the same part of the immune system, just two different ways to go about it.
So if you react to a skin test, you have a true allergy?
That is correct. That is correct. Absolutely.
So do your patients pay out of pocket for these lab tests, or is there any insurance?
Yeah, so secondary insurance, if people have naturopathic medical coverage, so if someone has chiropractic or massage or things like that, oftentimes they'll have some naturopathic coverage to a certain amount for the year. I'd say about 80% of our patients get their blood tests for foods covered under their naturopathic plan. There's about 20% that don't, just depending on what type of plan they have. But I'd say the majority of patients do get reimbursed for that blood test. The blood test is a $295 blood test through the private lab.
Okay.
Yep.
So say you didn't have any food intolerances.
Mhm.
Is taking a probiotic through pill form
Mhm.
and the fish oil and all that, is that too much? Like, should you do it naturally, or would you recommend every once in a while?
Yeah, great question. So yeah, foods come back totally negative, no signs of food intolerances whatsoever. A probiotic at that point, I'd say, is not a must-have. I'd say for other reasons, for optimal health, overall improving immune system, that's something somebody could use on a daily basis. Or some of my patients will use it for 3 months, take a couple of months off, use it for a few months, take a couple months off. That would be a way I'd address probiotics if there were no confirmed food intolerances. Fish oils, has such a far reach in so many other health conditions and so many benefits to it. Fish oil is probably one of the 2 or 3 things I think we should all be on. So regardless of food intolerance results or not, fish oil is a very good option to be taking.
And like the L-glutamine?
Yes, I wouldn't even go down that road. That's exactly right. So if someone's showing no signs of inflammation in their bowel, things like L-glutamine, I wouldn't necessarily put them on. Yep. Again, sometimes other things can show up, parasites and other things like that. So if someone has no food intolerances that show up, we might go to stool testing or something else, looking for some other bowel issues separate from foods. If something shows up positive there, then that's where we might go ahead and do that. Okay? Good question. Other questions about anything about foods or anything about bowels, actually? Pick my brain. I'm happy to answer that as we're finishing up the food stuff, because like I said, we're going to totally move to hormone discussion after this. Yeah.
I was thinking in your bowel,
Mhm.
if there's damage,
Mhm.
will that show up on like a diagnostic?
Yeah, great question.
Something
Great
or
question.
scopes?
Great question. So yes, this is where that integrated medicine comes in. So for a lot of my patients, I'll send them for a scope if I'm suspecting something more than foods, or if treatment isn't improving their symptoms as expected. So when we think about scopes, we think about like ulcerative colitis and Crohn's disease, where we see true pathology with a camera. That's what's going to show up. Sometimes just general inflammation. A doc who does a scope will say, nothing in particular, no disease, it was just inflamed. That's a common answer that we'll get. So serious food intolerances are long-standing unaddressed, can cause that just inflamed look in the bowel. But you're not going to see, like I say, a ulceration in the bowel because of food intolerances. You're not going to see bleeding most of the time. So that's why most patients who show up in my office, they've been through scopes. You know, they have all these stomach issues. They've had X-rays and ultrasounds and scopes, and they're told, you know, everything looks good. I don't know what it is. We don't know why you're having that bowel issue, and that's commonly where someone gets thrown into an irritable bowel syndrome classification at that point. It's basically saying, hey, we hear you have all these concerns. We know it's affecting you, but we can't give you an answer why, because all those diagnostic tests are showing up normal.
And then do you do lab work for vitamin deficiencies?
Yeah, so we'll do the vitamin deficiency lab work once we've kind of got somebody through that healing process at that point, because then we kind of know where we're starting from. If we put in nutritional treatment, then we have something to compare it to on a retest. So, you know, geez, your B12 is really low. We went through this series of treatments in 8 weeks, and now your B12 is back into the normal range. Then we know what's working for that patient.
And does Alberta Health pay for those?
Yeah, so most times I'm trying to work with a family doctor. So I'll send a patient back to a family doc and say, hey, can you run a B12 level for me? This patient's had all these intestinal issues. We've healed things up. I want to start them on B12 shots, but I want to know where we're starting from. Most family doctors are really happy to do that. It's not an issue. For the few that aren't as cooperative, then I can send my patients to the lab, but patients have to pay for it. So that's sort of our very last resort. Hopefully we're usually getting a family doc to work with us.
Okay, yeah, because some of those micronutrients are really expensive.
They are really expensive. Yeah, absolutely they are. So like I say, if we can avoid that cost, like I said, I don't have to go there that often. Most times a family doc is more than willing to run some micronutrients for us just to give us a baseline. Yep.
And how long would you supplement them with vitamins?
Yeah, so great question. So number one, depending on how low they are, obviously is going to determine before we do a recheck. So I mean, if someone is just at the bottom of the pile, you know, we're going to probably do 8 to 12 weeks of therapy before we'd even consider retesting. And then what we do is on that first retest, we get a sense how quickly they're rebounding. If they're not fully rebounded in that 12 weeks, but they have a really good movement the right way, then we can kind of guesstimate how much longer we need to do to get them in that normal range.
Okay. And then you wean them off.
That's right. Yeah, absolutely.
You don't supplement for people who are in a normal range, do you?
Depending what normal is, that's always the debate. I have a lot of patients who are in the normal. We'll talk a lot about that with thyroid tonight. But there's a version of normal and there's a version of optimal. And so we're looking for optimal levels. So I mean, if someone has a blood value in the normal range and they're feeling good and there's no clinical signs that tell me they're deficient, then I'm not going to supplement them in that situation.
But they could be within a normal range and you would supplement in this?
Yeah, I mean, sometimes patients come in a quote-unquote normal range, and I disagree and think they're far off the mark. I see that a lot with iron levels. I see a lot of women who come in with ferritin levels, which is iron stores, and they're just brutally low. It's technically in normal, but it's not even close to where it needs to be and is oftentimes causing fatigue and other symptoms. I'll absolutely supplement them to get their values up. Yeah.
So what do you think is a normal level then for iron?
For iron, sure. So ferritin, technically the lab says, well, we have 2 labs in town. One lab says 15 and higher, the other lab says 25 and higher, with 100 being the cutoff. Research shows 40 to 60 is an optimal ferritin level. So all patients come in at a 12 and their doctor will be like, that's a little bit low, that won't be causing fatigue. I see 4s and 5s all the time. I mean, that's a huge component. So if someone's even at 15 at the cutoff, to me they're well below where they need to be and oftentimes have symptoms because of it. So again, that's one of the things we do is kind of go through labs and see where someone is in that normal. Keep in mind, conventional docs are crazy busy, so unless it flags it as an abnormal, a lot of times it doesn't even catch their attention, right? So it's nothing negative on their direction, but if it's right at 15 at the cutoff, doesn't flag it, so it just doesn't get caught, and a patient's lingering right on going low. So
then does iron supplements bother people?
yeah, a lot of the over-the-counter iron, if anyone's taken iron, you'll know like constipation and bowel issues commonly come with that. And the main reason being is that they're really big doses of poorly absorbable iron, the pharmacy brand or the prescription brand. So it'll be like 300 milligrams of an iron that is really hard to absorb, which is why it usually causes constipation. So we'll just use more absorbable forms at much smaller dosages that do the same job, but without the side effects from it. A little converter there for if you, you got it. Awesome. Yeah, so foods, food intolerances, diets. So I know diet's a big thing. A big thing for me is don't spend a bunch of money on grocery bags of supplements, right? It's food first. Supplements are truly just a supplement. So if we don't have the food piece right, we're going to miss the boat with all the product, the money, the guesses, the rest of it. So food first, whatever that food program is that works best for you, use it. And if there's questions about what the right foods are for you, then there's solutions to find that out as well. Okay?
And so out of, say, that 30%, how many people would have multiple
Yeah.
intolerances?
I'd say at least half. At least half the people I test who are positive have more than one food group they're sensitive to. Great question. And as they age, the more likely they have multiple. We'll catch kids at 3 years old with one food group because they haven't had that many years to respond. So what often happens is, let's say a child has a dairy intolerance from a young age, 1, 2, 3 years old, and dairy keeps going in their diet, in their diet, in their diet. Eventually the immune system starts responding to other food proteins. So now they're responding to dairy and gluten. And then both of those go in for another 10 years. Now they're responding to dairy, gluten, and eggs. So by the time we catch them, there's a whole bunch of food intolerances. The good thing is most of the time we cut them all out and we challenge them in. Usually they can successfully challenge everything except dairy. That usually tells us that that was the very first culprit that started the whole process. All right. Yeah, Colleen.
Can you talk a little bit about the IV therapy, like the vitamins?
Oh, sure. Yeah, this would be a great spot to jump in there. So in terms of, I guess, nutrient sort of replenishing is a great place to bring this into discussion, but we actually do IV nutrient therapy in the office. So we're using vitamins and minerals in an intravenous form. So we get 100% absorption, so we know you're getting everything that we're putting in that IV bag, and we can do a lot higher dosages in IV than what you can do orally. So for oral vitamin C, most people can only tolerate 3 to 4 grams of vitamin C a day before you start getting loose stools or diarrhea. In our most basic IV bag in the office, we can get 12.5 grams of vitamin C in you in 45 minutes with no bowel issues. So when we're trying to replenish, IVs can really speed up the replenishing, which means people's symptoms tend to clear up a lot quicker. Again, magnesium is a big one that a lot of people are deficient in, so muscle cramps, muscle recovery. So by putting magnesium in IV bags, patients will feel it like that night. They have chronic leg cramps, for example, 1 dose of magnesium in an IV, and they'll say, within the first couple of nights, cramping was gone at that point. So IV nutrient therapy is great for replenishing nutrients. Great in some other areas too. I'll talk a little bit about adrenals today too in IVs. But yeah, it's really cool. Anything from minerals, B vitamins, vitamin C. We put amino acids in there as well. We can put homeopathics, a couple herbs we can even put in IV-wise. So some really cool stuff just to really optimize health and optimize nutrient status. Selenium, chromium, things like that.
And are there any, can you overdose that? Or?
Great question. Yeah, so what's nice about anything we're putting in an IV, we call it water soluble. So any excess, your body's going to excrete out. We can't put you in a toxic level. So we don't put iron in IV bags. We don't put vitamin D in IV bags. So all those vitamins that we can become toxic on, we don't put in there. We're basically overloading the body so it can take on as much as it can, and then the excess gets flushed out typically within 12 to 24 hours of the IV. but it has long-lasting effects. Someone who gets benefit from an IV, they can go 4 weeks with that same benefit from just one dose of the IV, just because your cells are taking it all on at that point in time, and it's lasting longer. But yes, so someone with my patients with Crohn's and colitis and all this sort of stuff, very often IV therapy is part of it. Absolutely. Yeah.
Just going back to the milk and gluten intolerances, in your opinion, do you think it's more like now this day and age, like you were thinking, is it a fad or is it actually happening? Like, do you think it's how they're making the milk and how they're making the gluten that's causing?
Yeah, I mean, the milk proteins haven't changed a lot over the years. I think that the processing of milk, I don't think that's a culprit as much as I think just the amount of milk protein that's in all the foods that we eat. I think just the quantity of it is a huge part. I think just the awareness of people having all these intestinal issues being to food is increasing as well. So a bit of awareness, we have better ways to identify it, test it, confirm it. And I think things like the dairy protein is in so many places now, especially for kids. And if you look at a typical kid's diet, the amount of dairy protein and gluten protein is scary, how much they're getting. And it's not even foods that you would think have wheat or dairy in it. Wheat's another issue. I mean, genetically, wheat is different than what it was 50 years ago. So there's a lot of theory that that genetic change in the wheat is what's causing a lot of our issues absorbing it as well, because our bodies don't know what to do with it, or at least a percentage of the population's bodies don't necessarily know what to do with that genetic makeup of those types of proteins. So, you know, I think wheat, because it is different, is part of that issue. I have patients who are from Europe who live here now who can't eat wheat here. When they go home to certain parts of Europe, they can eat wheat and have no issue. But it's still a lot of ancient grains in a lot of the European countries that have not been modified. So genetically speaking, our grain in North America can be very different from the grains in different parts of Europe. I know even Famoso Pizza in town, if anybody's eaten there, they bring in their wheat from Europe. So I have a lot of my gluten sensitive patients that can actually eat their regular pizzas there with no issue. They have a good gluten-free crust as well, which is like really, really good that patients do well with. But I think when we hear things like that and stories like that, that yes, the actual processing genetic makeup of wheat is part of the issue. I don't think it's the whole thing, but definitely a piece to the puzzle.
So someone that doesn't have a gluten intolerance, would you recommend that they stay away from eating a lot of?
Yeah, I think it's moderation. It goes back in that any food, whether it's good or not, if we're eating too much of that food, we're setting ourselves up for an intolerance. I have people who have cut out dairy, and then what they've done almond milk and almond butter and almond everything, and then they're intolerant to almonds. Happens all the time. So to me, I think that's just, again, almonds are a great food. You know, everybody should eat almonds. So for me, I think that just no matter how good the food is, if we're overloading our bodies with one type of food repetitively, we're opening the door to an issue. And I think that's where rotation diets, variety in our diet comes in. We all talk about, yeah, get variety. But I think even from an immune standpoint, it's really important that we do that. A lot of people talk about eating seasonally, which I think is an awesome idea where we live. So, you know, in the fall, there's lots of root vegetables and soups and stews and that sort of thing. So, you know, what our gardens produce in the fall in Alberta. So if we focus on those foods, you know, by the time we get to spring, those root vegetables aren't things we're typically eating. Now we're more doing, you'll find in the summer, you tend to crave more salads and fruits. Those are very cooling foods, like energetically speaking about food. So I find if patients eat with the seasons, we're lucky to have 4 seasons in some way, that it forces you to change your diet up over the course of the year versus eating the same thing every day. A lot of patients who go to fitness competitions and things like that, that's a great way to start a food intolerance. You know, chicken and eggs every single day for 7 months and limit caloric intake. Just opening the door to having a food intolerance or food sensitivity, even if it's healthy food.